course in it in Zoom, but we're so excited for all of you to be here today. And today, this is actually something that we've been doing all across the city. We've been doing these webinars, or actually seminars throughout the city. We've moved them to webinars, but this one is sponsored by LT Senior Services. And LT Senior Services is a Lake Travis resource, and the importance of it is that they're trying to serve and engage aging adults and their families in the community. So this is the nonprofit. It's a 501c3. That's one of the reasons why we're able to do the food drive, and people are able to give us money, and it's a tax deduction. So it is a 501c3, and our goal is to help seniors and their families in the Lake Travis area. So we are the sponsor of the webinar. My name is Cindy Cummings. I happen to be one of the founders. There were several of us, but I'm just one of them. And I happen to be a realtor. I work for Realty Austin. So I also have an ancillary business called Turnkey Transitions. We have several other members who are on the call today, and I'd like to give them a chance to just say hello if I could. So our first will be Karen, and Karen's with the library, and she wants to just talk for a minute. And you've been unmuted, Karen, so tell us a little bit about what the library is doing during this time.
Thank you, Cindy and Natalie. Thank you so much for hosting these. This is great. The library, everything is closed, but all staff is checking email and we're still open. The library definitely has a digital library, so if you have a library card, you can definitely email me or anybody on the staff and work with us, and we can get you access to the digital library. So you can still download books and audiobooks for free onto any device like your phone, iPad, or read on the computer. And then in addition, we are trying to start some virtual programming, and it's all through Zoom, just like this. So there's a lot of information on the library website, but we just wanted to let you know there are still books available. I know folks are reading a lot, or maybe reading a lot, but it's hard sometimes to think about where to get those books, but there are ways to get free books through the library still. Thank you, guys.
Excellent. So you guys are still working?
Yeah,
You're still working? So
yeah, we're all working from home. We're all checking email. We're definitely looking into how library services might be going online for now and in the future. And then right now we've got some virtual programs, like at 11, there's a coffee chat and bring your own book and some chats and things. So
nice. That's great that you're still able.
Oh, I think we lost her. Did she cut out for you all or just for me? I think so. On my screen, Cindy froze. But yeah, I'm happy to answer any questions about the library, and that we still have some virtual services going just like this on Zoom. So as Cindy said, Zoom is the way the whole planet seems to be on this application. So I think, did you want someone else to introduce their business?
Yes, but I don't know who's next on the list. Let's see. Stephanie, were you planning on introducing yourself?
Yes, I'm working on my Zoom. There we go. I am with HomeWatch Caregivers. We are non-medical. We are definitely still essential and working in senior communities and in homes, even when some, non-essential, maybe physical therapy or things like that have ceased with them. So we're still here, and we're happy to help, and very happy to be included in all of this conversation. It's very helpful, so appreciate it.
Awesome, thanks. And then I think Brian, but I don't know if Brian's on here. I don't see Brian. And it looks like we lost Dr. Carlson too.
Yeah, it sure does. I see that. Let me see if he sent, no text. He's probably getting back in, hopefully.
Yeah.
But I'll briefly introduce.
But here he is.
Is he in?
He's in the process, I think, of coming in.
Very good. And if you'd like me to, Natalie, I'd be happy to introduce him and Be Well MD.
That'd be great.
Okay. So my name is Ann, everybody. I work with Dr. Carlson, our guest speaker on this webinar. We are with Be Well MD. So we are a medical practice that's designed specifically for seniors. That's all we do. Dr. Carlson is a fellowship trained geriatrician. He sees patients in their homes, and now he also sees them via telemedicine, which is the topic for today's conversation. We have several nurse practitioners who also meet with seniors in senior living communities. So specifically in Lake Travis, we go to Lake Travis Independent Living, among a few others, and see them in their homes or in a clinic space. All primary care. We take Medicare in those clinics, and Dr. Carlson's services are private pay. So if you have any questions about that, please reach out to me. I'd be happy to share any additional updates. We also are just providing telemedicine visits to seniors in their homes. You don't have to be a patient, and you don't necessarily have to be a concierge member of Dr. Carlson's either. So if there's any seniors that just need just straight consultation, we provide that service as well via telemedicine.
Great. And to all the participants, if you have any questions that you want to ask Dr. Carlson, if you could go ahead and type those questions in the chat for us, or if you wanted to, ask a question yourself, that's okay too, but sometimes just typing it in the chat's a little bit easier. So just wanted to let you know about that. And you can find the chat by hovering your mouse at the bottom of your screen and just click on chat. And I'll go ahead and just send a chat message so that everybody can see how it looks. And then also just know that we're recording this as well, so you could watch it after the fact if you wanted to rewatch it or share it with someone.
So, should we turn it over to Dr. Carlson?
Yeah, that sounds good.
Dr. Carlson, can you hear us?
I can. Can you hear me?
Yes.
Yes.
Okay. I got kicked out for a moment, but I'm back in. So the joys of COVID-19 and all of the new skills that we're able to learn, we can take advantage of the technology. Of course, COVID-19 comes with a whole lot of risks, and I'm not going to belabor those. I'm going to look at the bright side of things and all the silver lining advantages that this is presenting to us. All of us get to spend a whole lot more time with our families right now, and we are able to learn these new technologies, learn these new skills and ways to keep in touch. And from a medical perspective, the telemedicine issue is one that has needed something to help it go from where it has been to being readily utilized and allowing all of us to take advantage of it. Telemedicine has really been around for about a decade, and it has gotten to the point where it is mature enough to deal with a large percentage of the problems that we all deal with within medicine. Of course, we're never going to be able to get totally over some of the hurdles that we face. We know that we can't hang an IV medication via telemedicine. We're never going to be able to do procedures via telemedicine, or at least not in the near future. Robotic surgery is something that can be done, but it's got very limited scope right now, and it's going to be a while before those sort of things are dealt with via telemedicine. However, probably 70 to 80% of all doctor visits are things that can be done via telemedicine. And over the last decade or so, as the technology and the bandwidth, the pipeline in and out of individuals' offices and homes has gotten richer and richer, the telemedicine possibilities have expanded. Even 5 years ago, when I started BULMD, we were to the point that telemedicine was possible, but it was not really feasible for us to do, even though we tried it. We tried very hard, trust me. but it didn't work. And the reason that it didn't work was primarily because the system at large, Medicare, the insurance companies, the hospitals, and the doctor's offices just were not prepared for it. And there was really no impetus for us to do so, to get that framework, that infrastructure in place in order for us to do the telemedicine routinely. And now one of the side benefits of this pandemic is that it has let everybody know, from the very highest level down to the individual, that this tool is needed and we need to utilize it, learn how to utilize it. And as probably all of you have experienced to some degree or another, these telemedicine visits are coming to the forefront in order to stop the pandemic. And so with the telemedicine that we have available today, we are using it in our practice, as are many. And I wanted to just give you that little bit of background leading up to now, and then share with you my experience and how we utilize telemedicine. And to start that conversation, I'm going to give a definition to telemedicine, because really there are multiple different definitions for telemedicine, and there's different labels for it, whether it's telemedicine, remote medicine, telehealth. You're gonna see and hear all of these different labels for it, and oftentimes you're not going to really know what it means. But in a broad sense, telemedicine, telehealth is using technology to connect the clinician with the patient. And that technology can be anywhere from a Zoom meeting to robotic surgery to using a patient portal to using email, text messaging, and of course the form that we are all used to for the longest period of time, the telephone. And the telephone remains one of the key aspects to telemedicine. But basically, telemedicine is a way to meet the patient's needs, do the examination, do the doctor-patient interaction in a technology environment rather than a face-to-face brick-and-mortar office visit. And as we are learning right now, we can deal with a large percentage of the problems, of the issues that we need to deal with in medicine via telemedicine. And just think about how much you were able to do with just a telephone during all of our lives up until the last maybe 10 years. That was the primary mode of communication. And now we've got all of these additional modes of communication that make it more complicated in some way, but in some respects, it makes it easier. The text messaging tool, the email tools, the portal, the Zoom video conferencing, all of these are modes of communication that expand our ability to do the doctor-patient visit in real time in a way that obviates the need for you to come to me. And we can do this while you're sitting in your living room or bedroom. I'm sitting in my office, and we can just make it more convenient for you. And that was one of the initial goals that BeWellMD had for telemedicine when we first started, was to try to make it easy for the elder to see their doctor, to have their needs met as efficiently and easily as possible. So with that, we started implementing telemedicine about 5 years ago. As I mentioned previously, because the infrastructure wasn't there, because patients and the clinicians really were not set up to do it, it was a very tall order. We met with a lot of resistance, and it wasn't quite ready to use. But now with the pandemic, we are finding that all of the tools really are here, and it's just a matter of us learning how to do it. And so With that, I will share with you some of the barriers and how to get over those barriers. So one of the things with elders that I've learned is that as elders get older, their cognitive and physical disabilities present more and more of a challenge for them to do their routine activities, the activities of daily living. And so they oftentimes need help from a family member or a caregiver to get to the doctor. You know, that can mean even just the simple task of getting in the car and getting to the doctor's office. And in many respects, telemedicine has some of the same barriers. It doesn't have that physical barrier like driving to the doctor's office, but there is this barrier of managing the technology, managing the connection, the pipeline. And that is something that oftentimes the elder is going to require some sort of support. The caregiver, the family member that is able to help them make the connection. I suspect that the vast majority of people that are in our conference room right now, this Zoom conference room, probably that doesn't apply to you because you're doing this independently, but maybe there are a couple that are doing this with supportive family or caregivers. But that is one of the barriers that we have to overcome. And so the elder who does need that support, just because it's a Zoom meeting or a telemedicine visit that's going to occur at home, it doesn't mean that the caregiver or the family member can just say, oh, mom or dad can do it on his or her own. They still may need to be that extra hand, that support piece with mom or dad in the living room or the bedroom to do the doctor visit. And another key piece, another key hurdle is what I call the telepresenter. It's not feasible for most of us to do these telemedicine visits where the patient is doing all of the technical pieces, just like I mentioned with the video conferencing and so forth, but also having a trained telepresenter, somebody like a medical assistant or a nurse that is with the elder in his or her room is very helpful to get the vital signs and get the help the doctor do the examination over the teleconference line, over the Zoom connection. Having that piece in place is one of the things that I've learned that makes these telemedicine visits much more complete and much more valuable both for the patient and for me, and allows us to accomplish those things that need to be done. And then another hurdle that I'll bring up is the fact that the connection, even as we've seen on this video call, my connection dropped off for a minute or so and I had to reconnect. So one of the most important pieces to take advantage of all the technology is to have a rich Wi-Fi environment in our homes. And this applies not only for telemedicine, for many of the things that we are able to take advantage with now here in 2020 and beyond. The Wi-Fi environment allows us that pipeline to bring information into the home and send information out of the home. And I encourage everybody to focus on their Wi-Fi environment, if nothing else, because it's gonna allow you allow you to take advantage of so many different aspects of our modern world, and it will make your technology experience better. If you have a rich Wi-Fi environment at home, it's going to make it easier for devices to connect. You'll have enough bandwidth to operate the different devices, the multiple different devices that are all connected to your system. And so if there is one thing that I would recommend everybody to do right now in preparation for telemedicine visits in the future, and for all of us to take advantage of the technology and the connectivity that it provides. It is to make your Wi-Fi connection as good as possible in the home. So then when you call me next week and need a doctor's visit, the opportunity is one that we can take advantage of most completely, and that pipeline connection is going to be there and ready for you when you need it, so that we can deliver information back and forth to each other readily. So those are probably the biggest hurdles that I've encountered. And after we've done a number of these video telemedicine visits, my numbers are in the many hundreds, if not thousands by now. We realize that it is a learning curve. None of us have to learn how to sit down with our doctor across an exam table or side by side in an exam room. That is something that all of us have learned how to do over the course of our lifetimes, you know, whether that's a few years if you're a pediatric patient, or a few decades if you're an adult, or many decades if you're an elder. That experience is one that we just, it's second nature. But this experience is new, and it's a skill that we all have to develop. And so doing a video chat, whether it's on Zoom or Skype or any other platform, is another skill that all of us can practice by connecting with our families and friends during this pandemic social isolation period. And so again, this is another silver lining to this. It's helping all of us learn how to utilize these technologies better and be prepared for the telemedicine visit if and when that is part of your healthcare experience. That's really the high level view that I have of telemedicine. And I suspect that many of you have already experienced it to one point or another. But maybe I'll stop here and see if anybody has any questions, any specific aspects about a telemedicine visit that I might address.
Yes, everybody. So I'm not sure. Sorry, I got lost there in the connectivity. I need to work on I have Ethernet, so I don't even know why I had that problem. But anyway, it was probably described to you to use the chat if you want to. And a lot of people do like to use the chat. If you go down towards the bottom of your screen, you'll see a little, it looks like a little chat box. Go ahead and click on the chat box. And then when you have your question, you can either have your question just go to one of the moderators, or you can have it go to everybody. But we also want people to talk. So if you feel comfortable asking a question, just unmute yourself. And the way that you unmute yourself is you go up into the top right-hand corner, and there should be an unmute box, and you can just go in there. But to kind of get it going, I had a question for you, Dr. Carlson. How many people, like what percentage of people were using telemedicine before, and what are you seeing now, and what do you see in the future? Just kind of interested in the trend.
Okay, so I don't have perfect numbers to answer any one of those aspects, but in the past, less than 5%, so pre-COVID-19, less than 5% of all doctor-patient visits were being conducted by telemedicine. And those visits were primarily done or often done in a couple of specific settings. Rural settings, so in areas where specialty expertise was not available, and then the VA system. Those were the two primary places where most telemedicine visits were being conducted. And that's because, in part, or in large part, because that is where the system was set up to allow those kind of visits. And I'll just tell you that one of the biggest barriers that we've had is the fact that Medicare has not, prior to COVID-19, has not reimbursed telemedicine visits for non-rural areas. But with the pandemic, CMMS, and I applaud them for this, they recognize the need to accelerate the accessibility of telemedicine to the population at large in order to combat the pandemic. And so they took away many of the regulatory burdens that goes along with telemedicine. Number one, they agreed that they were going to pay me for my visits. And number two, they took away the state-by-state licensing requirements. So for instance, if I need to do a telemedicine visit and I am not in the state of Texas physically, previously I could not do that telemedicine visit, but now I'm able to do so no matter where I'm located, and as long as I'm licensed in any of the 50 states of the US, I'm able to conduct that telemedicine visit with you. And so just by CMS lifting the regulation, it has allowed it to expand dramatically. We're probably going to hear in the coming weeks or months how many of these doctor visits are being conducted by telemedicine. But I'll give you one example of how prevalent this is right now. One of my urology colleagues, I need to consult with him about one of our mutual patients. I called him this morning at his office, and where was he conducting patient visits at? Not in his office, but from home. And so I suspect that we are going to find that almost overnight, we have gone from less than 5% of patient visits to probably 50, 60, 70% of patient visits, outpatient visits, being conducted via telemedicine because of the pandemic. And then going into the future, this technology is getting bigger and bigger all the time. Our bandwidth is greater, and when you look at 5G technology, which is already here, it's just a matter of implementing it properly, and that's going to take a few more years. But if you look at the 5G technology, it really dramatically expands our ability to communicate in real time and in a way that is going to benefit both the clinicians and the patients. And so this is something that now CMS has broadened the opportunity for us to conduct these visits. I think it is a genie that they let out of the bottle, and they're not going to be able to put it back in. And so this is one of those benefits of the pandemic that I believe we're going to be able to take advantage of, not only now here in the spring and summer of 2020, but going into the future. This is the springboard to make this better and better for all of us.
What would you recommend somebody do? Let's say I'm not sick right now, but should I talk to my doctor now, get set up on the telemedicine, so if something were to happen, everything is ready to go? I know you guys are super busy right now, but what would you recommend?
So I think my answer to that in terms of what to do now is a couple of things that I've already recommended. Number one, make sure that your Wi-Fi and your connectivity is good in your own home. And then number two, make sure that you know how to do some video conferencing. Practicing this with friends and family now is a perfect time, because we don't have the opportunity to go out to eat. We don't have the opportunity to go out for coffee face-to-face. But you do have the opportunity to contact your friends and or family and have a video conference. My family, we had Easter, we didn't have Easter dinner like we were planning, but we had Easter video, Zoom, or Easter via Zoom all together. And there were about, I would guess, almost 20 of us on a Zoom call on Easter Sunday a couple of Sundays ago. And we thoroughly enjoyed, well, I don't know how thoroughly, but we enjoyed it. Yeah. And I would say that practicing by having having friendly family chats with you and your friends and family is a way to develop the good skills that we need to deal with a video conference rather than a face-to-face chat. For any of us who have done these kind of meetings, we know that there is a little bit of a lag. And if anybody watches the news, we realize that these video connections are not quite real time. There's always a half second or a second lag. And so it's real easy, if you don't practice it, to talk over one another and then everybody's confused. But it doesn't take very long to develop this skill. And developing that skill over a cup of coffee is probably the best way that I would recommend developing the skills to do a video chat or a telemedicine visit with your doctor. And then finally, the last recommendation I would have is make sure that your doctor is conducting visits by telemedicine. I don't know what percentage of offices are doing this, but I would guess to venture that the vast majority of them are doing it, just because doctors' offices are in the business of meeting patients' needs. And this is one of the tools that is relatively easy, not easy, but relatively easy to implement to meet your needs.
Great. We have a Zoom comment. Let me just go ahead and read it. The library is also hosting a weekly tech coach chat with Mrs. Raj on Wednesdays at 10:30, where you can also practice Zoom video calling and ask other technology questions. So be sure to go to the library and log in for that. Yeah, I think contacting your doctor and just making sure they're doing that kind of telemedicine is something critical. And although the technology might be hard, think about getting in your car, driving, parking, walking. I mean, that's hard. So if you can figure out the telemedicine, it seems like a no-brainer to me.
Cindy, you got a stat just this morning, and I'll just share it with the group. And this is the other end of the spectrum, but Texas Children's in Houston, they reported that from late March to early April, they went from executing just a few virtual health visits to more than 2,200 a day.
Oh my God.
That's pretty significant.
Wow.
2,200 a day from Texas Children's in Houston.
Wow.
Yeah, that is a perfect statistic to exemplify how instrumental this pandemic is in changing our lives for the better.
Mm-hmm.
This is going to be one of the side benefits to the pandemic that probably 10 years from now we look back on, or 100 years from now we look back on, and we realize that the COVID-19 pandemic pushed telemedicine into the forefront, and that's when this really took off.
Mm-hmm. We have another question here. It says, are you able to use most video avenues such as Zoom, GoToMeeting, FaceTime, Google, blah, 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 blah. I mean, there's so many. Would you specifically recommend Zoom as the technology for you to learn?
And I'll tell you what, I am going to pause myself for just a moment and take a drink of water.
Okay, no problem. We'll have dancing music while he's doing that. I actually have been doing a whole bunch of Zoom meetings with friends, and my sorority sisters, we had a Zoom dance party on Saturday night. So that was fun. We all brought our favorite song from when we were in college, and some danced more than others, but it was really fun. It was really, and it's a great way to learn Zoom. And everybody's 59, 60 years old, and probably a third of them had never used Zoom. They had kids, grandkids helping them, husbands helping them. It was a hoot. But then afterwards, they're thinking, this is great because I can use this myself, for parties or whatever. So Dr. Carlson, what do you recommend as far as technology?
Okay, so in the world of medicine, I think we're all cognizant of the fact that we've got to maintain some level of privacy. And in usual times, in regular times, non-pandemic times, that level of privacy is very, very high. just like CMS has relaxed some of the rules surrounding the conduct of telemedicine regarding payment, it has also relaxed some of the rules around privacy. So your doctor's office it is incumbent upon them to maintain the privacy as best as possible. But as long as the doctor's office is making a good faith effort to maintain privacy, CMS has told us that they are not going to go after us for HIPAA violations like they might in regular time. And so therefore, any of those platforms in the question are suitable in April of 2020. As soon as the pandemic is over and the stay-at-home orders and the crisis is lifted to some degree, then I expect that we will likely be asked to go back to normal HIPAA privacy rules. And so at that point, your doctor's office should be implementing the proper platform to utilize. So for instance, in BeWellMD, we've been utilizing Zoom for many years, and the reason for that is that it is a HIPAA compliant platform. And we probably all heard about last week or the week before some privacy issues that Zoom experienced as they had so many new users and they expanded their capacity dramatically in a short period of time. I can say with a high degree of confidence that Zoom has addressed those issues very appropriately. And if you take just a little bit of precaution, i.e. using a password protected Zoom room, you can ensure that your visits are protected. And in this pandemic crisis, we don't have to comply with the HIPAA privacy quite to the same degree as we do in normal times. But in my practice, I still have a high degree of confidence in Zoom, and that is the platform that we're utilizing. And we're on the professional plan, so we've got an added layer of protection for our patients and our doctor-patient visits that we conduct by telemedicine via Zoom.
I have a question.
Sure.
Dr. Carlson, I met with my oncologist 2 weeks ago through what I'm guessing was her telemedicine platform. And it was like she was talking underwater and I kept communicating to her. I'm only hearing every third word you're saying. It's hard enough to understand complex medical information. You're talking about CMS. I don't know what that acronym stands for. So any guidance, I told her 3 or 4 times, I'm not understanding you, doctor. Should we unconnect and reconnect? But she just kept pressing through, and on top of not feeling like I had a useful visit with her, I'm creating anxiety about talking to her again tomorrow. So any advice for those kind of situations where the connection is failing?
Okay, so first of all, I'm sorry that you had that experience. And as all of us learn how to do something new, whether it's on the patient side of things or the clinician side of things, these sort of hiccups and barriers are going to become manifest. CMS, I'll just back up and let you know that that stands for the Centers for Medicare and Medicaid Services. And the communication about the communication barrier that you're describing is understandable for how anxiety producing that can be, because when you're talking to your oncologist, yes, you want to understand what's going on. You need your questions answered during that meeting. And so I would, if I were in your shoes, I would send the message today not tomorrow, to your oncology office. I don't know how easy your oncologist is to talk to directly, whether by text messaging, email, or through the nurse or the front desk. But I would do whatever I could to tell her your experience and the anxiety you have about tomorrow's visit, and let her know that the pipeline is one that is quite important, as we've talked about. And I don't know where the pipeline connection problem was in the visit you described, whether it was on your end or her end. I suspect that it has to do with the portal. Many of the doctor's offices are doing this under a very rapid implementation timeline. And they want to do it under the portal because the portal is the safest, most secure way to do it. But if I were you, tomorrow, if they haven't gotten that issue fixed, I would just tell your doctor that you want to connect either by some other platform other than the one that you're utilizing, whether it's Skype or Zoom or something else. And even just going to a telephone call might be the appropriate way to do it. And keep in mind also that you can do the video on one line and the telephone conversation, the audio, on a separate line. And I found that that is a trick that one can use when your bandwidth is limited in one fashion or another.
Okay, thank
So
you.
that would be my recommendation for tomorrow's visit. Don't wait to try to fix this tomorrow, because if it's a bad connection, in real time, you'll spend 20 minutes fixing the connection, and then your time for the visit is over.
Correct. All right, thank you. Great question.
You bet.
Anybody else have any questions? I'm looking in our chat box. I'm not seeing anything in there. We have Dr. Carlson on the phone for a little bit longer. It's a great opportunity to ask questions about telemedicine, and maybe he might even ask another question or two related to COVID if you have any of those. But I'm looking in the chat, and then anybody who wants to ask a question, you can just unmute yourself too. I'm always amazed that nobody asks questions. I have a quadrillion in my head. I don't know. I'm just constantly like, what about this? What about that? I heard that they're going to start elective surgeries in Austin on Wednesday. Had you guys heard that?
And this is the first I've heard of it, but I'm not surprised. I think that we've got enough data now to know that the threat to the public health system has largely been averted with the social distancing. And when you think about the entire pandemic, and everything that we're doing with social isolation, social distancing, stay at home, etc., the goal was not to stop the virus. It was just to slow down the spread. And the goal from the public perspective, the goal from the leadership of city, county, state, and federal levels was to protect the public health system from becoming overwhelmed and all of the negative consequences of that. And I believe, based on the data that I've seen, that we have largely accomplished that. And so now what we're getting prepared to do is figuring out how to allow people to get back to normal life. And we've got to now figure a way to individually deal with the risk of coronavirus, because until we have a vaccine, unfortunately, this risk is going to be with us. And our goal is to just not let it overwhelm us, and to deal with it on an individual basis moving forward, rather than on a global or countrywide basis, global, country, state, county, citywide basis. We're going to be shifting the emphasis on the overall community now to the individual side of things. That's my perspective.
I have to say, you know, as I mentioned at the start of this, our Dr. Carlson and our other nurse practitioners are in a lot of senior living communities across Austin, 12, 15 different communities, and they have done some impressive work, the management teams of those communities, to stave off the infection. I mean, they have 150, 200 residents living in some of those communities. And I think relatively, and Dr. Carlson would know more about this, but I think they've all maintained their safety and their health, and we're not seeing that run rampant in these communities. Like Travis Independent Living right there in your own community is one. Very impressive, I think.
Yeah, Lake Travis Independent Living, Belmont Village, and all of the others that I'm in. As of this point, Monday morning, April 20, I am unaware of anybody in my medical practice with the disease or any of the communities that we go to with the disease present in the community. And so again, the social isolation, the distancing, the stay-at-home orders have worked. Now we have to figure out how to resume living in a quasi-normal fashion and deal with the risk, again, not from not only on the community basis, but move over to the individual side and protect those vulnerable individuals in the community by helping them do the social isolation and minimizing their individual risk. And I think that is how we're going to be moving in the next few weeks and months as we learn how to deal with COVID-19.
It just kind of blows my mind thinking about think tanks and groups of people who must be trying to think about how to do it. Because I mean, I've just thought, okay, but if they do it, then they bring, it's like an ant farm, you know, and you have a little ant go out and they get something, they bring it back to the farm, then everybody gets sick. And then it's just mind blowing. How do you solve this issue? It's just, I don't know. Some smart person's going to figure it out better than I can. That's
I
for
think
sure.
it's like buying time, really. That's what we're trying to do, right? Dr. Carlson, is buy time until that vaccine is available.
Yes, exactly. And from the very beginning, we were doing things as a country, as a state, as a city, based upon incomplete information. And that information, that body of information is much more complete today as compared to 6 weeks ago, or even 3 months ago. But we are still learning. We still have a long ways to go, but rest assured, the body of information, that puzzle is being filled in very rapidly. And many of the quote unquote missteps, or what is being portrayed as missteps, really is just the fact that we're having to do something to deal with a very serious situation without perfect information, without that perfect body of knowledge to guide us. And we are getting closer and closer to the point where we do have the appropriate database to direct what we do and to open up and return to more of a normal lifestyle again.
Well, I'm looking in the chat box. I'm not seeing
another
anything.
question.
Oh, good. Yeah, Susie, what do you got?
So, Dr. Carlson, you said make sure your Wi-Fi connection is as good as possible now, so it's good when you need it. And you mentioned 5G technology. I don't know if I have 5G or 4G. I guess I should call my Spectrum provider to find out. Is that correct?
Well, yeah, the 4G, 5G evolution is something that you probably don't have to worry about, meaning that's being dealt with on the system level, i.e. AT&T, Spectrum, Verizon, those on that level, they're rolling that out. The Wi-Fi environment you could fix today if you wanted to make a trip to Best Buy or one of the stores and just make sure that your Wi-Fi environment at home is as good as possible. But a good way to do it is just to do an internet speed test. Go to Google and type in internet speed test. And if you're getting numbers 4, 5, 10 megabytes per second or less, then you need to do something. But what that is hard to say. And that's where you may need to contact your internet service provider and figure out where the slowdown is at. If you get numbers measuring 50, 70, 100 megabytes per second or above, then you've got a bandwidth in your home environment that is good, and you're not going to have to worry about that. What was the other part of your question?
I don't know, but I do have another part. So should I be doing this Zoom call right now on Wi-Fi instead of my regular connection? Are you saying that?
And either way is fine. So are you doing this on a computer that is connected to your system?
Yes.
It's got a wire. Then you're set. So if this is the setting that you're going to use for your visit tomorrow, I don't think you have to worry about that at all, because your wire connected, your Cat5 wire connected computer is going to be every bit as good as Wi-Fi or better. So I don't think your slowdown is almost certainly not going to be on your end. It's going to be on somewhere between your home and the doctor's office.
Okay, thank you.
Yep.
All right. We're going to do one last call for questions, and then we're going to let the good doctor go on to his daily routine at Lakeline Oaks. You got a whole bunch of people you're seeing there, Dr. Carlson?
Oh, maybe not a whole bunch, but we've got patients lined up, yes.
Yeah. So we've got another comment. The library tech coaches are available to work with anyone one-on-one virtually. You can email them at techcoach@laketravislibrary.org. Tech coach. Charge for non-practice consult. So Dr. Carlson, with the advent of Medicare and being able to do telecommunication, are you taking any clients? How does that work for you then?
So we are taking anybody for those who wish to make Be Well MD their primary care practice. Then we would just enroll them in the usual fashion and then submit charges through Medicare. For those patients who are just needing a one-time visit via telemedicine for whatever reason, for instance, if their doctor doesn't provide the service, then they have the option of paying a direct fee of, I believe it's $50 for a 20-minute visit.
Oh, terrific. Okay.
Yes, that's correct.
Yeah, excellent.
Okay. So before we
I think that
end
answers.
this, I just need to point out the good Miss Cindy Cummings, who conducts this work. I've known Cindy as long as I've been here, and she is a star in the world of elderhood and does so much. And I think much of what she does goes unrecognized. So I want to applaud her and hold her up and thank her.
That's very kind of you, Dr. Carlson.
I completely agree.
Completely.
Thanks, guys. Well, we're excited to have completed another great webinar. We're doing it, guys. We're still the info out. It's great information. It's everyday info. We need it. Thank you for taking the time, Dr. Carlson. Next week, we have our seminar is going to be on scams, you guys. And there's a whole bunch of scams going on right now. It's really, it's terrible, but a lot of terrible people are coming out of the woodwork right now. So we're excited. So we hope to see you next Monday at 10:30, and we'll have a whole webinar on scams. Thank you, everybody.
Thank
Thanks,
you.
everybody. Bye-bye.
Bye-bye. Have a good day.
Bye.